The project of the idea behind the project of pediatric or children's heart hospital in Sulaymaniyah city comes out in around 2005 and 2006, where there was a lot of patients coming to be taken care by, and actually at that time there was nobody to do echo even for the diagnosis. So our vision at that time at first was to start with a program for diagnosis by echocardiography, actual diagnosis, then to start to treat them by cath and later on by surgery. So what we did at that time, we put a project which comes into life in 2009 by signing that project with one of the hospitals in Italy to build infrastructure for us here in Suli. And the project started in 2011, and then in 2013 the project was at its end, and it stopped by the financial crisis that comes out at that time after the crisis of Daesh and ISIS here in the region. So everything is stopped, and the project was at its end by 5%. So just 5% was not finished at that time. Then everything is stopped. But at that time we were able to build at least the infrastructure for the diagnosis and doing some cath procedures in the old hospital. But the vision and our prospect to make this project a pediatric or children's heart hospital in reality comes out again in 2018, when some financial improvements happening and people comes to help us, like different organizations trying to help us with finishing the hospital, making available for the equipments, the consumable and the devices, as well as the machines and ventilators, etc., for the different departments of our hospital. Now our hospital it's very partially functioning. We are just caring of those patients coming seeking for the diagnosis, and we are performing echo and some basic investigations. Now the cath lab, the intensive care and the cardiac surgical unit is not functioning at all because of the some equipments we haven't in such a big facility. So really what's my message is that we need help in the form of making those equipments to be available. Like, for example, we need intensive monitoring for our patients. We need some surgical instruments for doing surgical procedures, as well as we need some equipment for monitoring and ventilating our patients in the ICU. So that's my request, if possible, somebody to help us about.